GERD, otherwise known as GORD, or gastroesophageal reflux disorder, is basically a very common problem, and we can call it the problem of the new ages. It is manifested by symptoms of mainly heartburn, that is, chest burning in the center of the chest, and sometimes this burning can move towards the left side, and many a times people will think this is a heart attack. So it is one of the symptoms of non-cardiac chest pain, GERD. Sometimes these symptoms can be more at night, especially when the patient is sleeping, and it will disturb their sleep. And some of these patients may have regurgitation or otherwise reflux of the gastric contents into the esophagus and also in the mouth. And some of the people will get up in the middle of the night due to wheezing. It is actually not an asthma. It is otherwise known as nocturnal asthma caused by aspiration of the gastric contents into the lungs. So this is the other symptomatology of GERD. The common precautions everybody must take is, if they have these symptoms, is they should have their dinner at least 4 hours before sleep, have lifestyle modifications, namely, if they are obese, they should reduce their weight by regular exercise. Yoga will help by doing some breathing exercises which will help in strengthening the lower esophageal valve. The other thing is, patients must have regular workout by doing other forms of exercise, as well as avoiding whatever foods which aggravate this. Some of the common foods which are responsible for GERD are, you must ask them to avoid aerated drinks like Fanta, Pepsi, things like that. They should avoid fried things. They should avoid lemon, grapes, dates, as well as some people have problems when they take caffeinated drinks like coffee or masala tea. So such things must be avoided. The other thing is, they can take drugs if they have the symptoms are very severe. Usually we advise them to do a course of proton pump inhibitors, drugs like proton pump inhibitors. We usually give them a PPI test, which is known as, for 2 weeks. And if they feel better with that, we'll ask them to either continue or a routine endoscopy can be done. One, to check how the valve is, as well as to find out whether the patients have already developed complications of reflux. Some of the complications of reflux are development of what is known as the gastric mucosa will come into the esophagus, which is known as Barrett's, or they may develop prolonged things because of Barrett's. They can develop some strictures, or they can develop some ulcers in the esophagus. So all these things are there. Depending on those complications, we can treat.